Welcome to the second video of the series related to problem-based learning, and in which this video we will be describing the 7 steps or Maastricht model of problem-based learning. Maastricht model is widely used model in problem-based learning, and the goal is not to memorize the steps, but to understand the educational rationale at each stage to identify where facilitation is more critical. Now let us see the 7-step model of Maastricht. So we have the problems and the group members and the scribe, the leaders, and the facilitators. We have 2 sessions. This is the first session, and here the second session, and we have time between the 2 sessions, which is basically for self-study. And we may plan the curriculum with activities that should be aligned with the case scenario, which will be presented here in the first session. The first step, the students, when they receive the case scenario, they should clarify the concept, and they should know the difficult term. Then they should define the problem. What is the problem about? Then they have to analyze the problems and the brainstorming. I will give you example for each one. Then they have to do like initial concept mapping by problem analysis and systemic classification. Then they have to formulate the learning objectives. Here they go for the student and the scribe should document each point that mentioned by the group during the first session. And this session basically at the beginning of the week, if we are delivering the problem-based learning in weekly basis. Then students will do self-study, and we may design the curriculum in a way that to support this. And actually, the curriculum should be designed in a way that support this step. Then we'll have a discussion for the second session when they come and report with each other. And the evaluation should be throughout the process. Let us now learn the educational purpose of each of the following steps. We have explained here the 7 jump. Let us know now the educational value of each one of these. The aim is to clarify the unfamiliar terms. This will help the learner to have a shared understanding and activate vocabulary and the prior knowledge. The second stage, when it's come to define the problem, the aim here will help the learner to identify the learner challenge and prevent premature closure. Brainstorm phase 3, generate explanations and activate prior knowledge and promote hypothesis generation. Systematic analysis or systemic analysis and classification, which is initial concept mapping, structure reasoning, and reveal knowledge gap. The final step, step 5 in session 1, student generate self-directed learning goals, metacognitive self-assessment. Self-directed study in which the students will learn about the case scenario, and also they will use secondary resources and the lectures and the activities to support their learning related to this case scenario. The second phase, which is step 7, when they come to share what they learn and they report, this will help them to reconstruction of knowledge in a clinical context. Now, let us start by this case scenario, and let us read this case scenario carefully. A newborn baby has a cataract and deafness. Obstetrician asked the mother if during the first few months of her pregnancy she had suffered from any disease or had taken any drugs. The mother says she had fever, malaise, and skin rash in the 3rd month of pregnancy. At that time, she had consulted a doctor in nearby health unit. The doctor told her that it was probably some sort of allergy and nothing to worry about. She was then prescribed some pills. This is a case scenario, and I should declare that this case scenario was developed 7 years ago when I was working in Qasim University in Saudi Arabia with one of our colleagues, Dr. Qaith and Professor Noor. Dr. Majid, myself, we work on these slides and we develop these slides for training. And this one of the case scenario we use early. Then the student should ask, so what do you think are the terms and the concepts that are difficult? Maybe for year one students, it could be the following: cataract, obstetricians, malaise, or maybe other term. So this is concept one, and they can open the dictionary, they can ask each other, but not the facilitator to know about this. Then they have to define the problem. What is the problem here? What is going on? We have a problem related to baby, which is congenital anomalies, and we have problems related to mother, which is skin rash, fever, malaise, and so on. It could be allergy or it could be due to the pill. So scribe should write these phenomena in boxes or circle in the board or using the computer. Then step three in the 7 jumps, we have a problem related to baby and we have a problem related to mother, and then they should go with brainstorming between the group, not the tutor, not the facilitator, explaining the elements and asking this question: why, how, what, where, when. This is called brainstorming, and between the groups. So maybe, why does the doctor ask the mother if she had some illness during the first few months? Any relation between this illness and problems? What are the medications that could cause these problems? Is it allergy? What are such defects called? Then they have to do stake 4, problem analysis, and this initial concept mapping by asking these questions. Maybe the mother had bacterial infections, and then they may think about bacteria, which bacteria causes anomalies, and so on. And they have to arrange the explanations proposed in the logical sequence, and each group member may produce a different explanation and different sequence of events, and this should be between the group members, not from the tutor. Then finally, they should write the learning goals and the learning needs. And the learning needs and the learning goals should not be like maybe anatomy, physiology, pathology. No. This will be against the integration in a problem-based learning. Always the learning needs should be linked to the case scenario and always keep the patient at the core of the problem-based learning. And maybe we can have some case scenarios that not necessarily to be a patient. And we can have a different format of problem-based learning, maybe for epidemiological problem or a research paper or whatever. But in most cases, problem-based learning, we are using clinical cases scenario. So here, it could be like this, as you can see here in the screen. Now, let us move to the session 2. And before moving to session 2, between the session 1, which include the 5 steps, clarifying the difficult term, defining the problem, brainstorming, systematic arrangement of the phenomena, and then coming with the learning needs, there should be a step between the second step, which is for self-directed learning, where students, they go learning from the laboratory, labs, simulation, clinical skills, teacher, resource sessions, libraries, and so on. What is the role of session 2? Session 2, where the cognitive payoff of problem-based learning occur. And here, students should share what they learn with each other. Students, they should share the information. They should fill any gaps in the concept. They should try to integrate the knowledge acquired. And students should never forget the patient in session 1. And students should always start by explaining what has happened in the patient body. What is the problem? And they have to rehearse what they have done and be relevant to the clinical context. Why this is important? Because this will make it easier to recall later in their practice. And one of the common problems in this session 2, in problem-based learning, is to have it like a presentation or mini lectures from the students. So the take-home message here is to avoid mini lecture in session 2. And all students need to be actively engaged in the session and focus on what still need to be clarified. And it is very important to share by sharing briefly the material learned by one member, which is particularly valuable or which shed specific light on the topic. And simply, they can explain the essence of the case scenario as the following. Come back to the group, ready to explain. What do students know? What is still don't know? Can they illustrate it? They can draw diagrams or show a chart or table. It's very important not to use PowerPoint slides, but they can use slides maybe to show X-ray or to show diagrams, figures, map, and so on. So in the session 2, it's very important to be considered as a collective knowledge synthesis, not individual presentation. Application of new knowledge to the original patient. Identifying any residual gaps or conflict informations. Evidence-based discussion. Concept map should be presented here. Collaborative revisions of initial hypothesis, and they should reflect what did we learn and what did the process well. These are the advice that should be considered by the facilitators. Start with who will present microbiology. This will remove the clinical context. This should be avoided at all by the facilitators. It's common mistakes. For example, students come to second session of problem-based learning and they come with the learning issues divided between them and they start immediately the presentation. This is not a good practice in problem-based learning. We should never allow students to do mini lecture when a student talk while the other disengage. We should never add the tutor to summarize and teaching, because this will affect self-directed learning. We should never accept shallow integration. For example, this virus caused a defect. No. And we should never skip the reflection stage due to time pressure and we should never fail to return explicitly to the patient at the session 8. Now, we come to the end of the second video in the series related to problem-based learning, in which we explain the 7-jump approach. And to summarize the 7-jump approach, we have 5 jump in session 1, we have the 6 jump in between, and we have the 7 jump in session 2. The 5 jump in session 1, clarifying the difficult concepts, defining the problem, brainstorming, then systemic arrangement of the phenomena, which is initial concept map, and then formulating the learning issues by the student. The jump in between, jump 6, in which is the self-directed learning, in which they learn from the learning resources, library, clinical skills, and so on. And then the last jump, which is the 7th jump, in which they come back and they share what they learn. The role of the facilitators in the entire process is facilitating the learning process. And the next video will be the role of the facilitator in problem-based learning. And it will be about how experienced facilitator can facilitate problem-based learning.